Hello, and welcome back to Live Out Your Potential, the podcast series brought to you by Solid Minds Counseling Clinic. I'm your host, Claver Irakoze, and as always, it's a pleasure to bring to you conversations that help you learn, get educated about different important topics that speak to our lives. Today, I have the pleasure of being with our guest, Kate Wolf. She is a seasoned behavior therapist with over 26 years of experience working with children and adults, supporting them with things to do with developmental challenges. Today, we are diving into an important conversation about child developmental challenges, and I couldn't think of a better guest to guide us through this conversation other than you. So, Kate, welcome to our podcast.
Thank you. Hello.
Hello. Before we dive into this important conversation about child developmental challenges, I would like to give you a little bit of time to share a bit about your background and the work you've been doing in this field.
Yes, so I've been working in the field for over 25 years. I work with children and adults with autism and their families. I work in homes and schools. I'm visiting Rwanda to support Solid Minds, and I'm meeting clients here and working with them, using my experience to inform my practice here.
Wonderful. To our viewers online, just to let you know that Kate meet people in person and online. And of course, you need to take an appointment before you can give you a chance to meet Kate. So let's dive into this conversation. Child developmental challenges. We know they affect families and many people, or let me say not everyone understands them. Can you briefly explain what they are and the impacts they have on children?
Yes, so developmental delays are very common in young children, and they affect speech. You could see a delay in speech. You could see meltdowns and tantrums and other problem behaviours. There may be difficulty with learning, acquiring early literacy and math skills. And these could be red flags for other disorders, or it could be that the child is just slower to develop and will carry on developing in a typical way, just perhaps slightly behind their peers.
Mm-hmm. You kind of mentioned a few, but we hear a lot about ADHD, the attention deficit hyperactivity disorder. We hear a lot about social and emotion disorder or delays. We hear a lot about speech and language delays, things to do with learning disabilities. And my next question is about how these challenges differ from normal variations in children development.
So yes, ADHD is becoming more common, and language delays also are common. Global delays, where a child may have delays across all areas of development, are also noticeable from a young age. And emotional and behavioural difficulties can also be seen from a young age. I would say that those disorders are quite distinct from autism spectrum disorder.
Mm-hmm. Distinct from autism, which will be possibly a topic for our next conversation. But before we get there, I want to come back to how these challenges are detected. And my question is for parents and caregivers. How can they recognize early signs of these developmental challenges you're mentioning? And at what age, if that age is known, should they start paying attention?
Yes, start to pay attention from as young as 2 years old. The first thing that you would notice is failure to acquire language in the normal way. The child may have few words and may not be starting to string sentences together. You may find that their play skills are limited also. And as a result of their limited communication skills, they may have more frequent tantrums and meltdowns, which would be as a result of the frustration of not being able to communicate their needs and their wants. The child may be very overactive, hyperactive, perhaps you would say, with a need for movement being one of the signs also, and stimulation, not being able to sit down and focus for periods of time, and some other interfering behaviours.
2 years, but how about those kids who struggle to even make the first steps? Should we wait until they are 2, or these key red flags you are mentioning have to be detected earlier than 2?
Yes, I think that the sooner you can intervene, the better the outcome. Of course, any intervention at any age is good, but if you can intervene and seek treatment and trust your instincts when you notice that your child isn't developing in the way that perhaps your other children have developed, or from not meeting their milestones, if they go to see a doctor to have the milestone tests that happen at 2 years old in the UK, you might start to have concerns. And my advice would be to act in seeking advice at that point.
This brings me to a question about, again, the red flags. Oftentimes we see kids who are typically normal, developing well, and then all of a sudden the regression starts. And you see different things happening. Their speech ability goes away. And I wanted to have your insights on what really happens in that context. A typical developing child experiencing regression after a certain age.
Yes.
What are the causes?
Yes, your child may seem to be developing in the typical way, and then at age 2, they may regress and lose language and other skills that they'd acquired. I think that this probably has been present from the start, and that the language loss has been a gradual process that seems to be abrupt, but in fact it happened over a longer period of time. And regression is unlikely in terms of changes abruptly taking place. It would be more a case that those signs were present from the start, from infancy, but were undetectable.
Let me pick maybe one among the very many challenges children may face, the ADHD.
Yes.
And from a layman's perspective, the attention deficit, how do you explain it? What are the visible signs? And is it something that we can attend to as adults and support children who struggle in that way?
Most definitely. Children that have ADHD, they would present as having difficulty focusing, desire for movement, constant movement. But if they're motivated by something, then you'd see a hyper-focus and concentration for long periods of time, very intense, almost to the exclusion of everything else. Mm-hmm. And impulse control, difficulties managing their behaviour, having the desire to do something and acting on it without thinking about the impact or the consequences. Mm-hmm. Difficulties in learning, early literacy skills as a result of not being able to focus or sit still. And there's many things that you can do if you're aware of that in a classroom situation to help the individual to focus better and to provide movement that they need throughout the day.
Mm-hmm. Is, for instance, ADHD something that can be cured?
No. It's a lifelong condition. I have heard that it does reduce as the individual gets older, and the symptoms change slightly, so you have less hyperactivity, but still the tendency to have hyperfocus, and anxiety is also a feature of ADHD as well, which I haven't mentioned. ADHD very often co-occurs with autism.
Which is probably why early intervention is needed if we are to look at better outcomes.
That's right.
So now let's talk about the cause. Some people talk about genetics, others talk about environmental factors. And my question to you is, are developmental challenges mostly genetic, or can they be influenced by environmental factors?
With autism, we know that it's strongly genetic, has a strong genetic component, 80 to 90% genetic component. With other developmental disabilities, it could be environmental, lack of oxygen at birth, but my knowledge is of autism, and I know that the environment, there's very little research to say that environmental factors have an impact on autism.
If we put aside autism and we look at other child developmental challenges, including the social and emotional delays, including the emotional and behavior disorder, are they genetically transmitted, or these are things that can be influenced by environmental factors?
I think that emotional and behavioural difficulties can most certainly be influenced by environmental factors. Yes.
How about ADHD, which is mostly associated with, in many cases, screen time? People spending much time, especially kids who are exposed at early age on these screens, losing their attention over time.
I have read that there's very little research to back that up. I do know that screen time has been linked to poor social communication skills and behaviour in classrooms. Post-COVID, most definitely we saw changes at that time, and that as a result of increased screen time, less social contact, fewer boundaries at home from parents.
Wonderful. So now let's look at the support that is available out there for parents and caregivers. If a parent suspects that their child has developmental challenges, what are those key steps they should take?
I would first see a doctor and ask for a referral to see an occupational therapist, a speech and language therapist, or a paediatrician to have a more thorough investigation of what might be the reason for those delays.
You kind of talked about this, but maybe it's a chance to again emphasize on that. How important is early intervention, and what kind of support is available for families?
Well, early intervention is key to outcome, I would say. The earlier that you can intervene, the better the outcome. But that doesn't mean to say that if you intervene at, say, age 14, the outcome also will be improved. It's never too late, I always say. In the UK, you can be referred to a speech and language therapist or an occupational therapist. In Rwanda, I believe the situation is quite different because there's very few occupational therapists.
Lucky enough, we have occupational therapists at Solid Minds. We have recently also hired a speech therapist, so that support is there. But
that's right.
I wanted to understand in a more structured way. What are those processes? Should people come to the therapist first, or should they go to the doctors? What is your advice?
I think that if you can seek therapy first of all, that's a really good starting point, because then any intervention can start straight away. Because if you wait to see a doctor, there may be a delay. And actually, when it comes to diagnosis, it doesn't really matter as much as intervening and starting the treatment as soon as possible, I would say. You could have the diagnosis starting to take shape in the background whilst you're seeking intervention from a therapist, a behaviour therapist, or a speech and language therapist, an occupational therapist. All three collaborate also.
Now, these children who are struggling belong to families, to the wide community, to schools. How can schools, for instance, and communities, in a more broad way, support children with developmental challenges?
I think sharing information and knowledge in schools, having training around special educational needs, looking at what the signs and the red flags are for developmental disabilities and autism, and putting in screening for things like dyslexia, which can be done by untrained people in schools, which could be a starting point to then seek help, and to understand what's happening in the classroom and how to change the environment in the classroom and the style of teaching for those individuals so that their learning increases. Maybe doing smaller group teaching with those children, or even one-to-one if it's a possibility, because many children with language delays, they may have auditory processing delays as well, which means that they find it very difficult to follow conversation or to take in information that they hear. And there are simple things that teaching staff can do. They can provide more visuals in a classroom. They can give instructions slower and make them clearer. They can provide a visual checklist for the child in a classroom, for example, for what they need to do to carry on their work. So there are lots of supports practical support systems that can be put in place, strategies in the classroom.
Wonderful. So, what is your message to issues to do with the stigma that's around families, but also stigma that directly affects these children who are struggling?
Yes, it's a good question, because I think very often people avoid seeking help because they're worried about the stigma around certain developmental delays and disabilities. And my advice would be everybody's different, and these differences are, with autism and developmental delays, could be to do with wiring in the brain, and it's a difference. And some of those individuals have strengths that typically developing children don't have. And seeking help could mean that those child's strengths are emphasised and they shine in areas that others don't, which could then reduce stigma, making them feel successful and more accepted in, say, a school environment. And with families, it's a process of acceptance, and denial is usually the first step, and then acceptance and grieving. But I think that if you feel that you're acting and doing something, and you start to see your child progress as a result, that's very encouraging in terms of seeking help and support.
Wonderful. So we are almost coming to the end of our part today, the episode about child developmental challenges, and I really wanted to maybe do some wrap up for our audience, and I will ask you to give us a message, especially a message of hope to families struggling to support these children with developmental challenges, but also struggling to even achieve the acceptance stage. Because what happens oftentimes is not only children suffer, but also their families.
Yes.
Because they don't know what is happening. When I was asking you questions to do with ADHD, it made me think of friends in our childhood who would be whooped for exhibiting special behaviors. But now I understand that maybe their parents did not know that these are behaviors that can be associated to developmental challenges. So as we wrap up, what is your message?
Yes, absolutely. I mean, some children with ADHD may be perceived as being naughty. That's quite right. So my message is to act on your instinct. It may be that your concerns come to nothing, but if you act on your instinct and seek advice and help, then I think the outcome is likely to be better than if you wait. There is help out there, there is support, and there's so much that parents and families can do on a practical level. Making small changes can have a very big effect on quality of life for everybody in the family.
Thank you very much, Kate. Key takeaways from our conversation today. One is, for me, I noted that these developmental challenges vary widely, and they vary from speech delays to conditions like autism and ADHD, like you were saying, and you advised for early detection if we are to expect better outcomes. You also advised that parents should trust their instinct. So if you're a parent, caregiver watching this episode, please trust your first instinct and seek help. So parents, if you notice delays, seeking professional advice is crucial. That's why clinics like Solid Minds exist. Come to us, you will meet professionals like Kate and others who are willing to support you. We also discussed about genetics and environmental factors which play a role in the development of our children. So genetics and environmental factors, they all contribute to these things we're discussing. But seeking support again comes as a solution, a journey we start early enough to make sure that these kids are attended and supported. Also, to close, I want to say that support systems exist, and that's why Live Out Your Potential exists, also to share knowledge, to share information. And I would encourage those of you who are watching to share this episode and make sure it is discussed in your homes. And where you fail to find solutions, please seek help. Once again, thank you, Kate. I hope
Pleasure.
we get to speak to you again in our next episode, which will be about autism.
My pleasure.
Thanks.